Fantastic. Well, good morning, everyone. It's wonderful to be here today at St John here in Ellerslie. And can I start by acknowledging the Right Honourable Winston Peters, my Cabinet colleague and leader of New Zealand First, and also acknowledge Associate Health Minister Casey Costello, who is responsible for emergency road and air services. I'd also like to thank Chief Executive of St John, Peter Bradley, for hosting us today, and thank you to you and your team who are here, and also Chief Executive of Wellington Free Ambulance, Dan Pallister-Coward. It's lovely to see you. Thank you for coming here to Auckland as well. Most New Zealanders grow up knowing that in a serious emergency you dial 111. When that call is made, it is often in moments of real stress, when someone is alone, frightened, or facing a situation when urgent help is needed. On the other end of the line is a trained communications centre operator working quickly to understand what's happening and ensure the right response is sent, whether that is an ambulance, clinical advice, or another form of support. What many people don't see is the growing pressures behind that system, increased demand on ambulance services nationwide, and the need to ensure crews, call centres, and clinical teams have the tools and support they need to respond safely and effectively. That is what today's announcement is about. I'm pleased to be here alongside the Right Honourable Winston Peters and Associate Health Minister Casey Costello to announce additional funding in this year's budget to strengthen road ambulance services, support frontline staff, and ensure the system can respond to growing demand. Today I'm pleased to announce a government investment of $35 million over 4 years to strengthen ambulance services across New Zealand and deliver immediate improvements for patients and frontline staff. This investment will importantly be in addition to an increase in funding from Health New Zealand and ACC for road ambulances to meet demand and cost pressures, with a total funding package to be finalised following negotiations for the next 4-year contract. A key part of this investment is the establishment of 2 new ambulance hubs here in Auckland, including one in South Auckland. These hubs will provide central bases for crews to start and finish shifts and ensure vehicles are fully prepared for service, strengthening coverage and response across a fast-growing part of our city. This investment will also support upgraded technology and stronger frontline capability, including the rollout of an electronic patient clinical record system to modernise how patient information is captured and shared, additional training support for ambulance communication staff, more clinical welfare checks for patients. And that additional uplift will also support additional frontline ambulance crews and 111 call handlers. Together, these changes will ensure ambulance services are better equipped, better supported, and better able to meet growing demand across the country. Today's announcement reflects the government's ongoing focus of improving access to health services wherever people live while maintaining responsible and disciplined public spending. As Minister of Health, I'm very aware that many demands of our health system and the public purse. Last week I was pleased to announce funding for a nationally consistent specialist paediatric palliative care service, and I'm equally pleased to be making this announcement today. Both initiatives, with more to be announced in the coming week, are possible because we are finding savings in Wellington's back office and reinvesting them into the frontline services that New Zealanders rely on every day. These investments are about fixing the basics, building the future of our healthcare system, and ensuring better care for the people who need them and depend on it. And I'd like to finish by acknowledging and thanking the Right Honourable Winston Peters and New Zealand First for the work they've done advocating for this announcement in our coalition agreement. And it's been wonderful to work alongside the Right Honourable Winston Peters and Casey Costello to deliver on the coalition agreement to better support our frontline road ambulance services. And with that, I'd now like to pass over to Winston.
Good morning, and acknowledgements to every special person here, which is the whole audience, I believe. Boosting ambulance funding was a commitment we made way back when we were in negotiations with the National Party. And the great thing about it is that you know the Southern American expression about being fast on the lip and slow on the hip. Well, we're not fast on the lip. We've done and delivered what we said we were going to do, and I'm very, very proud of that. I'm pleased to be here taking the next step in making another election promise a reality. Volunteers play an essential role in road ambulance services, particularly in rural and remote areas, and additional support for recruiting and retaining them will, we know, be hugely welcome. We salute these men and women who give their time to support their fellow New Zealanders at a time of need. An enhanced clinical hub, which is staffed with paramedics and nurses, will help more patients across the right level of care and access the right level of care as well, and sooner through clinical telephone advice while crews focus on higher acuity emergencies. The overall investment is expected to reduce avoidable emergency department transports by around 23,400 each year by 29-30, while supporting the infrastructure needed to improve service delivery and meet future demand. The new funding builds on the significant uplift of $77.7 million over the last 2 years for road ambulance services. One more time, $77.7 million over the last 2 years for road ambulance services. This means we now have record numbers of ambulance staff, faster response times for most serious incidents, and a far better use of resources. This government is making practical, common sense investments that are helping New Zealanders access health care wherever they live. This is a big day for St John's in particular, but also for everyone who will rely upon them in the future. Now, they say brevity is the soul of wit, so New Zealand ambulance services will be better because of this investment, and we are proud to announce this extra funding today. It's great news, and so we do expect it to be on the TV news tonight. Is that okay for you guys? Thank you very much.
Fantastic. Great. Well, with that, we're very happy to take questions.
Minister, just turning to the winter initiative, the winter plan initiative, you said that you're putting on extra additional nursing and clinical staff. When are they expected to come into effect?
Well, many have already been recruited, and many of those beds which we announced have already opened, and that's providing support to our hospitals already today. So a large number of those initiatives are already well underway or already implemented, making a big difference in our hospitals already. So that was across improving staffing, improving number of beds, also more aged care residential beds for step-down facilities for people to be able to be discharged into as well. So many of those initiatives have already been implemented ahead of winter to make sure that we can ensure the New Zealanders get timely quality access to healthcare throughout the winter.
How's it been finding the numbers? Have the staff been there to fill those areas?
Yeah, so there's been a significant effort in recruitment, and we can come back to you with the specific numbers. But there's been significant recruitment to fill those roles. Many of those beds are already opened in those hospitals that we committed to opening, and that's providing significant support to our hospitals already ahead of winter. And that's a big part of it. Of course, there's also the flu immunisation campaign, which I think is about to reach 1 million New Zealanders already. So that's making good progress, so that we can help meet our health targets and back our frontline workers who do an incredible job in our health care system every day.
How big of a role do ambulance staff have to play in the plan?
Well, they play a significant role. Our ambulance staff are on the front line every day, and part of this is to support our frontline ambulances, our staff, to be able to actually, as the Right Honourable Winston Peters said, prevent hospitalisations by ambulance staff being able to deliver care more in the community. And there's been, I think, a really strong relationship built between Health New Zealand and St John and Wellington Free in the last couple of years to reduce ramping at our hospitals and to support our shorter stays in emergency departments target, which is seeing improvements after years of decline under the previous government. So we've stopped the decline. We're now seeing a significant improvement against those targets, and St John and Wellington Free play a critical role in helping us meet that target.
Can you just talk a little
Last
bit
question.
about the regional connectedness of it all? How are the regions being catered for as part of this plan?
In terms of the winter plan? So the winter plan has initiatives in all 4 regions across the country. Many of those initiatives are already underway, already implemented, and that is making a difference in our hospitals already. We have brought back the health targets. The last government removed them, and those health targets were removed, and we saw wait lists balloon under the previous government. We saw the response times in our emergency departments crash. People were waiting too long to be seen. We are seeing significant improvements, and we're committed to continuing to improve outcomes in our health system under this government.
Just a bit more detail, if that's right, on the electronic patient clinical records system. What was sort of missing from what was being done previously in terms of how information is captured and shared, and why is this?
I'll ask Casey to speak to that one.
I think across the health system what we saw is that each of the systems were working in siloed. It's about sharing connectivity of the information. So the more access the ambulance services have to the patient records and who they're dealing with, it can assist greatly in avoiding hospital admissions, but also ensuring that they have the right information, particularly when they're dealing with critical patients with multiple comorbidities. So this is the response that we're trying to deliver around across all of these systems, but the better access to information is critically important, and this is the system that will allow that information to be made available to ambulance services. Because one of the issues that they have is not having relevant information about what are the conditions of that patient. So if they can diagnose better and they can avoid hospital admissions if they know more what they're dealing with, so they can respond. It does mean you don't get to hospital, but it does definitely mean that you have the opportunity. But I'm happy to get the ambulance services themselves to respond to why those systems are important.
We just said, do you want someone? Yeah, sorry.
Sorry, what was the question again?
How is progress with pay negotiations with ambulance staff? How's it looking?
So I think, as the Minister referred to, we've got the contract negotiations which will be following from this process. That is the negotiation between the government and the funding uplift that occurs, which will be the next 4-year contract term for the ambulance services, and their negotiations as the employer is with their staff. So the government doesn't negotiate directly with their staff.
Well, I can answer your question. This is an increase in funding. This is great news for St John. It's for Wellington Free, for the frontline staff. This is and the work that St John and Wellington Free do is all about making sure that we deliver efficient, patient-focused services up and down our country. Our frontline workers and the volunteers, which I think the Right Honourable Winston Peters acknowledged, play an incredible role. And this will increase the amount of funding that is going towards our road ambulance services. These are incredible charities. They do an amazing work. They receive significant support from New Zealanders who value their services and value the support that they do, particularly around the donation of ambulances, support around stations, and the ability for these organisations to respond quickly and to deliver services is something which I, as the Minister of Health, value significantly. This helps to meet more of their costs and to support the frontline workers who provide that care so that they can continue to support New Zealanders in their time of need. I'll get Peter to... Peter's one. Here's Peter.
I just... Yeah, I think we have to differentiate between the specific initiatives which have been announced today, which is fantastic. Two new Auckland big ambulance stations, which our Auckland team will be absolutely over the moon about. A new electronic patient record we've talked about, some other initiatives to improve staff welfare and patient welfare, fantastic. As the Minister said, we're yet to start negotiations with Health New Zealand and ACC on our new contract. That's where we talk about the sustainability of our funding going forward. We don't have a reduction in donations. In fact, the public continue to be unbelievably generous. That's continuing. What we do want to do is make sure the contributions from the government and from the public are reset to a level which we believe is sustainable. And
what's the shortfall, though? What's the actual shortfall in terms of millions?
It varies each year, so it's not an easy question to answer, and that's something we'd rather talk about with Health New Zealand and ACC directly as part of our negotiations. We've got very good relationships with Health New Zealand and ACC, and we want to honour our commitment to them as we start negotiations in the next couple of weeks of what we need and what's available. And we're confident that over the 4 years we will get a pathway to getting the funding to a level that we believe is sustainable for the longer term.
But this 35 million over 4 years, where does that sit in terms of
separate issue, really.
Yeah, so this will be on top of, as I said in my remarks and I said in the press release, this is on top of their funding that will be received as part of that contract negotiation. So the contract negotiation will look at the uplift and look at the demand increase, and it'll meet demand increases. It'll also look at cost price inflation and to meet the needs of the frontline staff. And this initiative today, this budget initiative, will be on top of that to make sure that we can meet particularly growing demand in Auckland, where there's a need for investment around stations. And the clinical portal, which the clinical patient record system, that is vital. That is a common sense initiative, as the Right Honourable Winston Peters would say, to ensure that we have a joined up system. If someone's got particular medications that or is on, and a patient, the ambulance officers don't know that information, that's a trip to an ED. If they knew that, they may not have to go to the ED. Those are the types of things that can mean avoidable admissions because of better information for our frontline staff. So those are the things that really free up the frontline staff and help them to be able to deliver better care. It is common sense. It will make a big difference.
But to what extent does this funding boost fill up the tank?
Oh, it's additional funding on top of what will be funded as part of those negotiations, and ultimately that has been part of our conversations with New Zealand First, is to ensure that it's not just yes, we're going to continue to invest in terms of meeting demand and meeting workforce and meeting the cost pressures, but also we want to provide additional investment over and above that, and that's what today's budget investment does.
Is there a bit of a timeline in terms of when all these new things will start to be rolled out or accessible?
Yes, so as soon as possible.
Minister Peters, this is a win for New Zealand First, but is it as far as you would have liked to have gone? Would you take it further if you could?
Well, look, the reality is it's over a decade when St John's came to us and presented their case, and a lot has changed in that time. We're in a very unstable world at the moment. Petrol prices, fuel prices are huge. A lot of the world's heading for a recession. And so the prospects we had back then and the percentages we talked about then have dramatically changed. This is the reality we have to live with. But the targets they asked us to set then, we've already met. They asked us to get to 90%. And we slowly got there. We've gone further than that, and I can't say where because we're in negotiations. But the point is, you could help big time. You could emphasise 4 letters tonight when you're writing your article, G-I-V-E. That is, give, when you're the public, and help out here. Because it's going to take us, both government and the public, to get this very essential service, critical in a tourism-dependent economy to where it should be.
Great. One more question.
Just a couple of questions, Minister Peters, for the Foreign Affairs portfolio. Israel's claiming 3 New Zealanders have been deported to Turkey who were involved in the Gaza flotilla. Is that something you can confirm?
Yes.
They have been deported to Turkey?
Yes.
Are they being offered any consular support to get back to New Zealand?
Despite us telling them not to go, yes, we are offering consular support, as we do all the time. We offer magnificent consular support over many, many parts of the world. I'm glad you've raised it, because it's time now to be rather appreciative of the level of civil service backup that's 24/7. And sometimes we've had teams working, 100 people, working around the clock 24/7 to help people offshore, and this is another example of it. Despite us saying, don't go there, it's not safe.
The Kiwi with hantavirus is in isolation. Are there any plans for how they can get back to New Zealand after that? Will they just be able to get on a commercial fly home?
Well, do you think it's a good idea for us to get somebody from hantavirus out of Perth and bring it to New Zealand? I don't think so. They should be domiciled there until they're safe. Well, after that, we'll sort it out, all right?
Thank you very much. Thank you. Thank you very much.